Hi, my name is Heath Pratt, and I'm the founder and CEO of Splynt, the new home for injury care. I've been a licensed athletic trainer for over 4 years working in a hospital and secondary school settings, and during this time I've been able to treat over 1,500 athletes from initial diagnosis to return to play. This experience has given me unique insight into a problem that exists with a lack of medical access and availability for those in need, especially in rural and low-income communities. So in March of 2020, I created a company to answer the call. We have almost 72 million athletic individuals in the US, and with so many individuals comes many injuries, just over 20 million, with only 4 million being evaluated and seen. This is directly tied to a lack of medical access, especially in youth sports where 85% of games and events don't have the proper sports medicine professionals present. If you look at the injuries further, you find that 23% fall into the severe category. Severe injuries are those that require more than 2 weeks of care, sometimes long bouts of rehab, maybe even imaging or surgery. 1 million of the injuries that fall into the severe category will never be evaluated or seen. So where are they getting the care now? Well, many go to the ER, where ER visits are about 8% musculoskeletal in nature, but over half receive no type of care while they're there, and 22% of these are due to sprains and strains, which handle really well outside the ER environment. And with healthcare costs increasing by almost 5% annually, patients are having a tough time navigating the current market to find the right type of care they need. At Splynt, we aim for the utopia: immediate access for anyone who needs it, an AI injury analysis tool to give you upfront feedback, and a managed care platform where you can find all your needs at the touch of a finger. Well, that time is now. Splynt is the one-stop shop for all athletic and occupational healthcare needs. It truly is the first of its kind. With their AI first responder and injury analysis tool, patients can answer simple questions and perform special tests to get upfront feedback on their injury, helping them make critical care decisions earlier in the process. And with 24/7 emergency telemedicine access, no matter where you are, you can connect to a healthcare professional like myself to assess and diagnose your injury, helping determine what to do and where to go next, saving you time, money, and peace of mind. It's the ultimate platform: exercise prescription, evidence-based care recommendations. From the first day of the injury to the last day, when you're back on the court or field, it can all be managed here. And the timing can't be better. With a 33% increase in telemedicine usage in 2020, the global market is expected to reach $185.6 billion by 2026. And with those costs increasing, patients are looking for other ways to get their health care, like concierge medicine and per-use healthcare plans. Our traction has been fantastic. With more than 20 patients treated, we've had 100% diagnosis accuracy and 100% patient satisfaction. Our primary market will be the athletics in youth and secondary school settings, but we're also going to look at industrial military, where they're having about 9 injuries per 100 employees, so we're going to launch there too. The current U.S. telemedicine market size is about $6.61 billion, with about 15% of that being related to athletics. We're going to make a 10% impact on that market, and here's how. For so many years, athletic trainers and physiotherapists have had the skills and tools to assess and diagnose injuries effectively, but no way to connect to people in need. Well, now they do. We'll begin with provider-based enrollment, having athletic trainers come onto the platform early and encourage their patients to find them there. We're going to do 2 study sites with more than 40 athletic trainers to assess the accuracy of the AI as well as the healthcare outcomes that come with it. And we're also going to do some free partnerships with youth organizations so both parents and athletes can understand the value of the program early. We're going to hit the ground running. As an athletic trainer myself, I'll be putting all my patients through the platform. I evaluate about 416 patients per year, so with more than 100 athletic trainers, we're going to have over 40,000 patients annually. We're going to do some partnering early with physical therapists and physicians in the area, so not only will patients benefit through Splynt, but the local community will benefit as well. Our competition is robust. There's some large telemedicine platforms out there, but the key factor is they don't have the ability to assess or diagnose musculoskeletal injuries. They can't. And those that can don't have the function to allow early onset access and give direct feedback to the patient so they have more power in the decision-making process. Our business model will be business to consumer and enterprise, with the consumer only paying for telemedicine and enterprise being $5 per month per user. We're very excited about the team. Smart Data is doing all the early development. Both Ryan and Devin have more than 10 years experience in healthcare and tech, and Zach and Matt are giving us the cutting edge on telemedicine and sports medicine as well. We're going to have the MVP done by the end of this year. We're planning on industrial expansion and insurance implementation early in 2021. Our handle and contact information is here. We're currently interested in meeting with accredited investors, and our call to action is this: if you or someone who's close to you has ever had an injury before, you didn't know where to go or who to call, we ask that you send them our information. Our goal is to make as big of an impact on this community as we can, and just one person through our platform is a win. We appreciate your time today, and we look forward to working with you.